I'm Raul Nogueira from University of Pittsburgh, Pennsylvania, United States. So I've been the co-director with Sordar Geek since the very first iCure. So iCure is, I think it's a very unique conference, okay? It really has the spirit of an acute stroke versus other conferences where things are more like what you expect. You follow a program. For lack of a better word, they are more structured and organized. We really chose to have more an impromptu meeting where you do have a program with main topics that you want to discuss. But as opposed to have the typical format where you have lectures and then you have to go through that program and you have to stop discussions even if they are having high educational value, we chose to go with the flow, right? Very much like in a thrombectomy case, you find new situations as you evolve during the procedure. We found new situations as you evolve during the discussions, and if things are going in a favorable direction, we continue those discussions. We stop the discussions if there are live cases, which is something that has been very, very unique about iCure. I believe it's still the only meeting in the world where you have live thrombectomy cases. We've been fortunate to have had very unique cases over the last several years, including cases of direct carotid puncture, patients with low NIH stroke scale that you chose not to treat after presenting the case in the conference, but they subsequently deteriorated and they were treated a day later. Patients that have had to have rescue stenting during thrombectomy, MIVO occlusion. So we have really been able to explore all these different topics unexpectedly with live cases and really comment on every single step of the thrombectomy procedure. Obviously, because you have to rely on live cases, which you can't schedule for thrombectomies, it's a hit or miss. So that kind of adds to this impromptu spirit of the iCure, which I very much enjoy. It's a different meeting. We also try to target a different segment of the attendees. You really focus in making this more like a global meeting, target to people who don't necessarily have access to some of the other meetings that you have out there for the stroke or neurointervention. Well, I think Mr. Clean is the landmark trial that changed the history of acute ischemic stroke forever. Not only, I don't like to talk about Mr. Clean as a trial, I like to talk about Mr. Clean as a group of investigators because they have done so much other than the initial Mr. Clean trial. And I think they are a model that has inspired many of us. Specifically, I try to replicate that model in my home country, Brazil. You create a resilient network, very much in that spirit of fostering academic communication across other centers. And they continue to innovate, they continue to form the next generation of investigators. I think it's just a spectacular movement rather than just the first single trial.